Hello, my name is Norishkaliz Gonzalez. I am currently doing general studies and I hope to become a registered nurse in the future. Today I will be sharing a plan to reduce overtime burnout, and turnover in our nursing units. I'll show the problems, what I found out in my survey, what I found out in research, and 3 ways we can try to fix these, and my final recommendation. So this is the problem we see every day. We don't have enough nurses. Patient needs to change a lot from day to day. Our schedule, they're too stiff. So we end up with last minute holes, long strings of 12-hour shifts, and many nurses end up missing their breaks. People get tired, safety risk goes up, teams turnover, and the cost of everything goes up because of overtime and the agency. And this is something that I'm trying to fix. So, just to get like a little knowledge of this, I ended up doing an online survey for nursing students and recent grads, but only 4 people ended up actually taking this survey. Everybody said that they felt exhausted sometimes or often, and they also said that most of their breaks were not covered either. I think it was my last question. I had asked them what would help the most, and this is what they said. They said that limits on back-to-back 12, I think it was 12 shifts, yes, of 12 hours, something like that. So it's like more hours, like let's say working like maybe 4 days a week, but I have to work 12 hours, and then I get, I guess, 3 rest days. So it'd be 3 rest days and 4 days working 12 hours a day. And I also have to get a guaranteed break for that shift. And I have to also have a team to help. And I need the schedule to be more flexible, like I said. The 3 days of break. 3 days of no work and 4 days working 12 hours. Yes. So for my secondary research, I did studies on how long hours without rest lead to fatigue and mistakes in how nurses do their job. So and I guess research, I learned that letting nurses pick their own shift, it gives them like a feeling of satisfaction, and it making them stay at the job. Like they keep on working and they don't quit. Float teams, they also cut last minute overtime, and it keeps coverage steady. And something else was newer scheduling tools can also make all of this fair and fast for the nurses. Before actually showing all of like the solutions and options and everything, I wrote ways to make all these plans actually work. So I said signs, which are simple alerts in the schedule. They would warn the nurses, like if they would warn them ASAP if there are too many, like 12 facts, like I said, which is like the schedule. If there's too many people doing that, it will let us know. If it would also let us know if there's not enough rest, if there's no break coverage, and if we're understaffed in a shift. Then I had meters, and they are like numbers we track, and they are like over time they keep us like, they let us keep track of overtime, agency use like money, break rate, and how people feel about the whole schedule situation. And then lastly, we have tags, and they're just labels like new to unit, and they just help us send flow to the right place and just avoid unsafe pairings. And I'd say these tools, they don't only like they don't really replace like the actual, like they don't actually solve the problem. They just like help to run the solutions smoothly and well. And then for my first solution, we have self-scheduling with guardrails. And this would be like nurses choosing their own shifts in like a feeling safe and with fair rules. And I guess the rules would be cap how many 12 shifts in a row. They would have to set real time to rest between shifts, keep a minimum number of staff, and share weekends fairly. And we would also start with a 4 to 6 week pilot in 1 or 2 units, give 2 to 4 hours of training, and make approvals clear so everyone can see how choices are made. And I guess this should give people more control and fairness, and it usually lowers overtime. And for my second solution, it would be a floative team plus firm limits and real break coverage. We would have to build a float team to cover gaps. We cross-train them for 8 of 24 hours. We would also set a hard limit on long runs for 12-hour shifts, and we make sure breaks are actually covered for everybody. And then we would track all of this in like a simple dashboard. And this would just give us like a steady coverage, less calls of like panic for overtime and all of that. And it's just better to like work with patients. And then solution number 3 is demand-based staffing. And we would just look at past patterns to predict like when the next busy day would be and all of that. And we would just set the right base staff and replace flow staff ahead of time on search days. We would start with the units that change the most and adjust every few months. This would mean fewer scrambles and like less overtime. And for my recommendation, I would say self-scheduling with guardrails and a float team with firm limits and guaranteed breaks. They both give us 3 things that we need the most, which are control over time, steady coverage, and real rest. So we would have to set the rules on short pilot a few units, give quick training, and use alert and dashboard to keep us on track. And this plan is really simple. I'd say it keeps people, like it fits what people ask for, and it follows the research that I did. So, yeah. And lastly, over time and in agency, they're short-term fixes. They're not like the solution, you know. The real fix is fair, flexible schedules and real protected breaks backed by a float team. And like I mentioned earlier, with signs, meters, and tags, we can keep it safe and steady. So, yeah, this is just something that I hope that fixes turnover over time and understaffing with the nursing field. Thank you.